Hello, AGNP students. Welcome to another week. We continue looking into the interprofessional collaboration between nurse practitioners and other experts or other healthcare providers. So this week, we'll be looking at how nurse practitioners collaborate with speech language pathologists. So, as you know, the aging population has been growing, and so does the prevalence of comorbidities like dementia, which often present a critical communication and swallowing, for example, issues. So, by working together with the speech language pathologists, we are able to improve the improve care of these patients. So we make sure our care is comprehensive, and we will discuss what the nurse practitioners do and what the speech language pathologists do to make sure that comprehensive care is provided to those patients. So we are at the front line all the times, like conducting the initial comprehensive assessments, like neurological or infectious diseases. And so those initial screenings may be also for cognitive or swallowing issues. And then we can refer to the speech language pathologist who also perform their own screenings, which is what we are going to see on the next slide. So after we make that referral, the speech language pathologist will perform specialized assessments of the patient, for example, speech, language, voice, and then swallowing capabilities. They develop their personalized treatment plans, such as safe swallowing protocols, specific exercises for speech, and then they implement, for example, augmentative and alternative communication tools. These are also given to other patients, for example, patients with autism spectrum disorders. And one of the most common concern in older adults is, for example, dysphagia. In this case, most of the facilities will involve speech language pathologists to prevent, for example, pneumonia and malnutrition. Aspiration pneumonia is the most common, which happens in older adult patients with dysphagia if it's not treated. So those facilities who involve providers, medical providers, and speech language pathologists have seen a dramatic drop in pneumonia incidence, and the quality of care has improved for those patients. So we frequently collaborate in major geriatric conditions. One of them that I mentioned is dysphagia, but also cognitive decline is another one. For example, dementia is most common. And for example, speech language pathologists can help identify the decline, and then the NPs, we can help manage the medical aspects of aphasia, dysphagia, and create, for example, dementia-friendly environment for patients with cognitive decline or Alzheimer's disease. So if you take a look at the workflow, so we see patients first most of the times. We observe, for example, how they cough when they are eating, and we can report this. We can formulate an action plan or plan of care, and then we can send that a referral to the speech language pathologist to do their own assessment, for example, evaluate the swallow function and modify the diet. At times we can do it if they don't have any other history like if they don't have advanced dementia or advanced Alzheimer's disease, or they haven't had a stroke recently, we can make some adjustments. But it's a good habit to send a referral for coordinated care. And this, how does this help? It improves patient outcomes. For example, I talked about dysphagia because it's the most common one that happens, but also cognitive decline. In all of these conditions or circumstances, patients will improve the overall quality of life. It also, reduces social isolation. So proactive collaborative care will also reduce the length of stay, for example, in skilled nursing facilities, and prevent costly hospital readmissions. So how can we succeed together? When we collaborate, there are three key components that should be present. For example, open, regular, and established communication. That's very important. Those channels are very essential to ensure both uh, speech language pathologists and nurse practitioners are always on the same page. Also, we should share patient-centered goal that prioritizes the quality of life. Another one is the mutual respect, which is very, very essential to value our unique yet overlapping expertise that we both bring to the table. So there are still barriers, though, to our collaboration. One of them is time constraints. For example, heavy caseloads. Sometimes nurse practitioners think like they are the only ones. We are the only ones with heavy caseloads, but also speech language pathologists have them, especially if they have to see patients every 15 or 20 minutes and have to do their own charting, which might be extensive. And in some facilities, there is joint rounding, and it works, but sometimes there's a lack of cross-disciplinary training. Like for some NPs, they might not think that it's necessary to send a referral because they may not understand well the scope of speech language pathologist services. But that's something we need to work on so that we can close or bridge those gaps that delay critical care interventions. So in summary of what we have been discussing, for example, I can relate to this quote from the World Health Organization, which shifts how healthcare workers interact. Interprofessional communication between NPs and SLPs is not just only the best practice, it's a necessity in the modern world because it helps maximize resources, mitigate those risks of, to patients, and provides our adult patients with the holistic care they deserve. Here are some of the references that support this collaboration. But remember, during the residency, you will meet a program director for the speech language pathologist who will tell you more about what they do. This is just a brief overview about one of the roles that we may play, especially in dysphagia. Dysphagia, you notice that it kept coming back and back, but also cognitive decline in patients with dementia is another important aspect of collaboration. Let me know if you have any questions. And I will see you during the residence when we talk more about this. Thank you.